Questions I hear about as a chiropractor is the chiropractic adjustment. What is it? What does it do? Why is it part of the treatment? Well, this question is what baffles many people about chiropractic, and it's actually fairly simple to understand once it's explained to you. The chiropractic adjustment is what the chiropractor utilizes to treat their patients. That's it. It's that simple. But many of you are saying, well, yes, we understand that chiropractors use it to treat patients, but what's it for? Why do you do it? We still don't understand. So let's step back and explain this a little more. Think of your medical doctor. Let's pretend we're going for our annual physical. So we show up to the doctor, fill out some forms, have our vitals taken, and are whisked back to see the doctor. Yes, I know it takes a little longer than that nowadays, but remember, this is an example. So we go to the doctor and he looks at our blood pressure. It's higher than it should be, so he takes out his prescription pad and writes us a prescription for blood pressure medication. This is how the doctor treats a problem. But we're not finished. After he's done more checking, he finds out our blood sugar levels are high. So he takes out his handy-dandy prescription pad again. Yes, it's the same pad. And writes a very different prescription for blood sugar medication or diabetes medication for all you medical aficionados out there. So you're escorted out, pay your copay, and then run off to the drugstore to start your daily treatments with your medical doctor via medications. So although you no longer see your medical doctor at his office, you daily begin treatment via medication for your symptoms. Now, let's go to the chiropractor. We show up to the doctor, fill out some forms, have our vitals taken. What? Your chiropractor isn't taking vitals? Oh, maybe it's time to look for another chiropractor. Are whisked back to see the chiropractor. Yes, that's more truthful. I've seldom seen nearly as long a wait at the chiropractic office. Then soon we're talking with the chiropractor. He does his exam and finds some issues with nerve irritation in your lower back. Well, and those nerves travel down your legs. So instead of taking out a handy-dandy prescription pad, he utilizes his hands or a machine or some other device to help relieve the pressure that's causing the nerve irritation, and that treatment is the chiropractic adjustment. But we're not done. As the exam continues, he finds that your neck and upper back are also experiencing areas of nerve irritation, and some of the nerves that are irritated go into the stomach, causing indigestion, and other nerves radiate down the arms, irritating the nerve that goes through the carpal tunnel. But wait, chiropractors don't use prescription pads to write scripts for Nexium for the indigestion or NSAIDs for the carpal tunnel. He uses his hands, or again an adjustment, on a different area of the irritation to help relieve the nerve pressure and allow the body to heal itself. Although the chiropractor is not treating the indigestion or the carpal tunnel syndrome, as the nerves in the body begin to repair, the symptoms of the nerve irritation start to go away. Now, wait a minute, you say, I have to go to the chiropractor for several visits for this to happen. At least that's the case for most chiropractic adjustments. So I say, let's go back to our medical prescriptions. How many days are you taking your high blood pressure medicine? Once? Twice? Or every day for months to years at a time? Even though you're not physically visiting the doctor every day, you are getting treated every day and every time you take medications. So the next time the doctor tells you you need to take a medication, you might want to ask how long it's going to take before you can stop taking the medication for the problem. We might be thinking a little different if the dentist told us we had to get our teeth cleaned at the office every day versus us using our toothbrushes and flossing. So although you may have to visit the chiropractor more often in the beginning, the goal is more like the dentist. Go one time and make sure you're doing the things you need to do to prevent the problem so you don't have to keep coming back to the doctor. This is a great way to look at all healthcare modalities. As the saying goes, an ounce of prevention is worth a pound of cure. We'll talk more about the chiropractic adjustment in the future.